Hello, my name is Patricia Hewen, and I am currently the manager of a community-based program at a children's hospital in New Orleans called Thrive Kids. Thrive Kids has a mission to improve academic and healthcare outcome for kids. So, how we do this is by partnering with schools to facilitate healthcare services for their students. We collaborate with the school's mental health and medical professionals to provide care coordination and resources for the kids in need of assistance or services, or even if a parent or guardian reaches out to the school with requests for different services that we may not realize that they need. We are there to assist with that as well. So, in collaboration with the school, since we're partnering with an outside source, it's very important that we are all adhering to the HIPAA standards that are set place for healthcare providers. So, that's what we'll be talking about today. So, the need to adhere to the Health Insurance Probability and Accountability Act is extremely important. This is also referred to, of course, as HIPAA. So it's a crucial component of healthcare practice. A federal legislation known as HIPAA safeguards the confidentiality and security of patients' personal health information. If HIPAA standards are broken, there are serious repercussions that can result from breaking these standards. Some include very hefty fines, financial obligations, reputation harm, and loss of patient trust. To avoid HIPAA violations and protect patient data, healthcare professionals must be proactive in their approach. Within our program, we must ensure that every child that we're providing any kind of services for, that we need to make sure that we obtain from their guardian a release of information, and we make sure that the parent is always involved with the child's care, and we are only sharing pertinent information. Even though we have that release of information, we are sharing pertinent information to pertinent people. We cannot just tell anyone at the school what's going on with this child. It has to be the healthcare professional, and the parents are always involved. Um, so it's very important that limiting authorized access to the patient's electronic medical record is put in place. We do this by putting access restrictions, and will allow the organization to make sure that'll allow the organization to make sure that the PHI is only accessible to those who are allowed to obtain information such as the health professionals and employees who are directly involved in the patient's care. This lessens possibility of data breach or unintentional PHI exposure by preventing unauthorized individuals from accessing or viewing the patient information. Access control can be given to providers that can give healthcare providers the ability to manage and monitor PHI access. This includes who can access the information, when, and for what reason. This makes it possible to spot any kind of shady or unauthorized access attempts, and to take preventative actions against any infractions. Access restrictions and user authentication tools can also help prevent insider threats, which happen when authorized people abuse or divulge PHI for their own advantage or malevolent purposes. Healthcare providers can stop illegal actions by their own employees or contractors by establishing role-based access control, lease principles, and strong user authentications. A clear audit record of users' activity is produced by access restrictions and user authentication systems. This can be used for forensic investigation in the event of any suspicious infractions. This encourages user responsibility and acts as a deterrent to unauthorized access or improper use of PHI. And essentially keeps people honest. You're not supposed to go in your own chart or your family's chart, only those individuals that you are on their care team. Um, so, in order to preserve patient privacy, uphold legal compliance, and manage reputations, and reduce financial or operational risks, it's crucial for healthcare businesses to ensure compliance with HIPAA rules. Thank you so much. Have a good day.